Doctor, if cutting to the chase with the World Health Organization, the latest missive to the world, I guess, we're letting our guard down too soon. A lot of people going back to complete business as usual. They worry that we're taking this lightly, are we?
I don't really see it that way, Neil. If you look at the way China's handling this right now and parts of Europe, and China's shutting down theme parks and they're shutting down whole cities. There's a city or two of a couple of 100,000 people that they're just shutting down. That didn't really work the first time around. If you're trying to accomplish a zero COVID outcome, it doesn't really work very well. We've been trying that for the last 2 years. We tried it here,
Yeah.
we've tried it across the globe, and it hasn't really worked. We're really going to have to learn to live with it. And thankfully, these new strains are mild, and except for people who are immunocompromised and the really high risk populations, it does not seem to be a huge threat. The deaths are down, the hospitalizations are down. Even as cases went up with Omicron, in January and February, the deaths and the hospitalizations didn't tremendously. So no, I don't think that the World Health Organization is correct in saying that we're letting our guard down too soon. It's time to start getting back to normal a little bit. The enormous economic, social implications that the mandates and the shutdowns have caused to our children and across our society, I think the remedy ended up being worse than the disease in a lot of cases.